Alexa. I'm a student physical therapist, and today I'm going to be showing you proper application for ultrasounds. And with my patient, the condition is going to be a chronic patellar tendonitis. So with this, I would go ahead and have my patient in the correct position, make sure that we have some draping so that there is her not contacting the actual table with her skin, and also I can go ahead and clean her off afterwards with a table. Excuse me, with a towel, not the table. From here, I'll go ahead and I'll get myself positioned as well, turn on the machine, and from here, I'll go ahead and select it to ultrasound so we can go ahead and show where the parameters are. So ultrasound, I'm going to go ahead and go to edit because I want to go ahead and make sure I get everything the way I want it. Because I assessed her patella, I palpated it, I felt around it due to her signs and symptoms. Her tendon is very thick. This is a chronic condition. Due to that, I'm going to move the frequency over to actually 1 because I want it to get deeper to that tissue because the tendon's very thick. From here, I want it to be a thermal agent because I want to bring circulation to that tissue, to that tendon nice and well. So I'm going to keep it on 100% duty cycle. From there, I pretty much have the parameters exactly where I want it to be, and I'm going to go ahead and make sure I have all my equipment. Before I press on, I'm going to go ahead and clean the thermal head. Very good. Then from there, I'll go ahead and I'll grab my gel. I'll put the gel directly onto the ultrasound head, as such. From here, I'll ask my patient, have you ever had ultrasound done before?
Yes.
Oh, you have? Okay, so you kind of know what to expect. With this specific application, I'm going to make it thermal. So what that means is you're going to feel some heat around this one tendon, okay? I'll ask you, do you have any issues with vascular compromise?
Nope.
Nope. Do you have any sensation issues?
No.
Okay. And have you had any recent surgeries that could have any metal plates or any plastic inside that I should know about?
No.
Okay, so then I'll go ahead and I'll continue with my contraindications, and I could ask her for more precautions. But for this patient in particular, she meets all of what we need. I'm gonna go ahead and put the ultrasound directly onto the tendon that I want. From here, I can go ahead and press start. From the start, I want to slowly keep moving it. I'm going to bring up my intensity to at least 1 because I want this to be a thermal. So starting at 1 is ideal. And slowly, I'm just going to go ahead and do circular motions throughout this tendon. Initially, I'm going to ask the patient, how does it feel?
Warm.
Warm. Any adverse effects? Example, do you have any tingling or numbness going down to your toe?
No.
Do you have any specific points where I'm pushing on your tendon that is a little bit harder than normal?
Nope.
Good. And I can explain to her again why we're specifically doing this. We want to bring heat to your tendon, especially with the stage that it's in, because we want to increase blood flow. We want to try and get healing agents to this tissue. We want to try and get some increased tension with this tissue because it's very taut. So the heat and all of these things are going to help with that when we continue on with our therapy. If we were to do stretching or whatever else would be good. Still feels hot? Good.
I don't know if Berkeley's Achilles tendon is treated enough yet. I think now you're going to be all uneven.
I'm pretty uneven actually.
Okay, about a minute and a half left.
A little more.
Good. So we hit our 3-minute mark. I'm going to go ahead and turn off the machine. From there, I'm going to go ahead and remove the ultrasound head, clean that off, and then go ahead and clean off my patient as well. Sorry about this. Good, clean her off. Assess the tissue afterwards. Make sure that there's some warmth. Make sure that there's no tenderness around it. Any abnormal sensations from when we started? I'm gonna take the new alcohol pad, make sure I clean that for the next patient. And then we can go ahead and turn this off. Or stop, or whatever else we need to do. And then we're good.